See, we have to, before writing this letter, we have to eliminate some unnecessary details. Okay, we have to eliminate. What are the information you are going to eliminate? Let's discuss that now. You are writing to a doctor who is the patient's own GP. The following patient has come to see his consulting doctor Cheshire Steele, who is no more working in the hospital where you are a staff nurse. Suppose you are working in a hospital, a patient is coming today, and the patient is asking that he wants to see Dr. Cheshire Steele because Cheshire Steele doctor is his own GP. Then you are saying, oh, sorry, Mr. Tom Pa, the doctor is not working here anymore. So he's working in a different place. It is recommended that you can go and meet him there. Shall I? Something like that. A patient is coming today. Then let's find out the patient, doctor here. You are Dina Grace, a nurse at Wimbledon Arc Hospital, where this patient came today. Okay, Wimbledon Arc Hospital is your hospital where you are working, where Dr. Cheshire Steele used to work. Using the information in the case notes, write a letter to Dr. Cheshire Steele, GP. Okay, so GP means this is the patient's own GP. Okay, Ormond Villa, Liverpool, Southshire, UK, to request further evaluation and its management. Remember, this doctor is the personal doctor or the GP of this patient. So the GP must be knowing a lot of information about the patient. Can you also see something more? When was the GP consulted by the patient before? How many? A year ago? A year ago. Good. Okay. A year ago, and the doctor is having some age-related problems, but we don't know whether it is a memory-related problem. A doctor who is having memory-related problem is really not going to continue his practice. So he is having some age-related problems. So since there is no memory issues, you can avoid so many things like lives with a wife and two sons. The GP knows that. So please remove that one from the case notes. Works in a fish factory, and working in the fish factory is already known to the doctor, most probably, unless the job was started recently. Okay, so this also can be eliminated. Also, smokes and drinks, the doctor knows that. Smokes and drinks, the doctor knows that. Very thin but healthy. Yes, even that is also known to the doctor. So you can avoid these kinds of things. Address, patient details, address. Do you think that the doctor is going to visit the patient or the patient is going to visit the doctor? Yes.
The patient is going to see the doctor.
So we don't require this also. Patient details, okay? And medical history, appendectomy. Since it was his own personal doctor, definitely the doctor knows that. And he also knows that he has no allergy. So I'm talking about the elimination part of this one. Father and mother have diabetes, both alive. This is also known to the doctor. Okay, then the only thing that the doctor doesn't know is this one. Maybe we don't know. Maybe the patient, Mr. Tom Palm, may have, after this admission, admitted to Wimbledon Arc Hospital with pain in the abdomen. See, on 29th December 2023, that means just last month, do you think the doctor was still working here? Last month, the patient came. Was the patient still working in the same hospital?
No.
No way. Okay. So from here onwards, you have to start, all of them should be included. So you have to start writing this letter. The second paragraph will start from here itself. So this is a starting point of the second paragraph. Readmitted is also something that happened after a few days. That is 17th of January. Okay, 17th. What is the date? Today it is 29th. Okay. So this is also unknown to the Dr. Cheshire Steele. These things are also unknown to Dr. Cheshire Steele. I hope you are all getting my point, all of you. We are eliminating some unnecessary details which we are not going to include in the letter because the doctor is the patient's old GP. So the GP knows that very well. No doubt about that. Even this discharge is also unknown to the GP. So this is the reason why we are including all these information in the letter. Now, this is 29th, the patient came today and you were there, and the patient came and wanted to talk to his GP. I have a confusion. I just want to see whether the doctor was here at the time of admission or not. Can somebody help me? The following patient has come to see his consulting Dr. Cheshire Steele, who is no more working in the. I want to see when the doctor left this hospital. Can somebody help? Is, is there any mention? When did the doctor leave this hospital? You are Dina Grace, a nurse at Wimbledon Ark Hospital. Using the information in the case notes, write a letter to Dr. Cheshire Steele. Oh, where is it? Yeah, there's a confusion here. This confusion can really happen in your examination also. How did we conclude that the doctor, the GP left this hospital a year ago? How do we know? Can anybody tell me? When did the doctor leave this place? Was the doctor present on this day? Hmm? Yeah. Hmm. Okay. Yeah, correct. I got it. So on 29th December, when the patient was admitted, most probably the doctor was here. So this is not a relevant one. This is semi-relevant information. We will include some of them. Of course, we cannot write a letter without this information. This is a semi-relevant one because it is known to the doctor. But from here, he wanted to consult on GP Dr. Shares, okay, who has now limited. That means the doctor was here. Yeah, correct. You're right. The doctor was here when the patient came, but the doctor left the hospital somewhere in between. Here, the doctor, maybe 29th, maybe 30th, maybe because it was end of the year, so he thought of changing the hospital, maybe on the eve of the new year. Possibility. So here, this is the this is semi-known case, and this is the area where you have to. So the whole thing should be included here. This also should be included in the letter. Okay. And then this also should be included in the letter. Okay. Then discharged, even that is also in the past tense, should be included in the letter. Then this is 29th. 29th means this is today's date, right? Okay. And this is completely something like a present tense is to be used here. Okay. And writing task is here. Yeah, correct. Now I got the whole thing. So where are you going to start this letter from? Where are you going to start this letter from? You can start the letter from the second paragraph will start from here. Now it is your turn. Now we are going to write the letter now. Today's date. Now you can see how I am going to write this letter. See, please look at this. I'm going to write this letter. In front of you, I'm writing this letter. You can just watch this one. First of all, let me remove all the unnecessary details from here. This much has been removed, and I'm also going to remove this area patient details I removed. Then social history I'm going to remove. Medical history I'm going to remove. Father and mother family history I'm going to remove because it is all known to this doctor, and this will be remaining here. I'm going to remove this area also because we don't need that. Now I'm going to start writing this letter. Today's date will come on the top, and that is here. So I'll convert this one into 29th January then a comma will be there, not mandatory. This is the first line. Then I am going to take the address from here. The address is here. I am going to copy this and I am going to cut and paste it here just below that. So we have got, you are Dina Grace. Okay, write a letter to Dr. Yes, Dr. Cheshire Steele, GP. You can write general practitioner, line, Ormond Villa, Liverpool Road, Southshire, UK. We don't require the country name because this letter is being written from the same country to same country. So this is the starting of the letter. Date is here and address is here. Then we have the next one. Dear doctor, dear doctor. If you want to write this way, dear Dr. Steele, even that is also completely fine. Then we have to find the RE line here, Mr. Tompa, and then give us. Okay. So we have completed the launching part of this letter is done now. This is a launching part of the letter. So in the examination, you have to be hurrying like anything like this. You have to hurry like this. Okay. Okay. So we have done the date is here. Okay. Date, D, then A address, D, dear, and R, DADR. This is a launching part of the letter. I hope it is very clear to all of you. We have done the first part. Now we have the second part that is known as the opening part. You should not waste more than 3 minutes for writing this part. All right. So we have to find out all those things. What do we need for this? We have to find out the patient's name. Patient's name. All right. Then for this, we also need requires. Okay, we can take it. Requires. That is the same word you have to write everywhere. In every letter you have to write. What is the purpose of this letter? You have to find out the purpose from this one. And then there will be full stop here. Then the present condition. What is the present condition of the patient? And then you have to also see whether it is a transfer or a discharge. All these things you have to find out. So how to start? Mr. Tompa, yes, that is done. Then go to the next one, requires. Please don't write the word who unnecessarily here. Requires what? What is the purpose of this letter? Can somebody tell me the purpose of this letter?
Further evaluation and management, sir.
Further evaluation and management. Very good, very good, very good. Okay, requires further evaluation and management. So we have done Mr. Tompa, patient requires our further evaluation. And okay, this is a purpose. Now we have to find out present condition. He is, yes, is he recuperating or he has symptoms suggestive of, or he is something. What is it? What is his present condition now? He has had overdose.
Very good.
Okay, he has had a medicine overdose. Okay, overdose on which was the medicine? Okay, okay, okay. He has possible. Yeah, possible. Sorry, possible. Yeah, he has had possible medicine overdose. What was the medicine? Mylanta. And now the last one, is it a transfer? Are we transferring the patient emergency, or is it emergency or is it urgent? And is being sorry, it's urgent, but it's not emergency. Okay, because urgent and emergency are different one. Okay, 1 second. Can I see this part? Patient visited with the diarrhea. Okay, cramping pain in upper abdomen. Yeah, update one. Okay, abdomen. Reported medicine overdose of Mylanta. Consulting, okay, on GP. Okay, it was just diarrhea. It's fine. He is not going to die soon, so no problem. Just diarrhea only. So it's not an emergency letter. Okay, so let's go back and write this completely. He has possible medicine overdose on Mylanta and is ready for transfer. Is that Milka, Milka, Milka? There is some noise. Okay. Now let me just make it more clear to you. Mr. Tomba requires further evaluation and management. He has possible. He has a possible. He has a possible. Sorry, he is has possible medicine overdose on Mylanda and is ready for transfer. This much is written. And remember, whenever you write opening paragraph, what is to be decided before that? PRPPD or PRPPT. Okay, PRPPD or PRPPT. Remember, PRPPD means the patient is being discharged and is going home. PRPPT means the patient is being transferred under emergency. It can be emergency transfer or it can be first, the patient will be discharged and then the patient will be transferred. This is a very crucial situation which some of you have not still understood. Remember, when a patient is being discharged, what will happen? The patient will go home. Okay. Then when the patient is transferred under emergency, the patient will go directly to the other hospital, especially emergency department. But in between these two, there is another one, PRPPDT. What's that? What's that? Yeah, the patient will first go home, then from the home, the patient will be transferred. This is something that many of you are unaware. PRPPDT. Okay, first, suppose a patient, in this case, this particular patient is having diarrhea. He's not going to die. So now, first you have to get an appointment from this doctor. The doctor is not going to say, okay, send him now. I'm free. No, the doctor has to give an appointment. The doctor is going to give an appointment probably next Monday, almost 1 week. So are you going to keep this patient in the hospital for the one whole week? No. You will ask, Mr. Pa, yes, we have just contacted your GP. Yes, what happened? They are saying that there is no, they cannot schedule an appointment for you this week. We are sorry to say that. Oh, really? Yeah, the doctor is so busy, it's difficult to get appointment from the hospital. So the doctor is saying that he's available next Monday. Is it okay? Yeah, it's okay. I will manage it. So what shall I do? Yeah, you can go home today. You can go home today, and then from there you can be transferred. You can take a taxi or something. Fine, Mr. Pa? Yeah, it's fine. This is what is really going to happen in real life. Okay, so Mr. Pa will be going home, and then from there he will be transferred. He'll be going to the so anybody having any question? Okay, so this is what I wanted to tell you. This is something very important. Opening paragraphs are PRP, PD. So now we decided that it is something like the patient is ready for transfer. Is ready for transfer. Anytime the patient is ready for transfer. So this is a combination of D and T. So you can write any of them. So is being discharged is also fine. Is ready for transfer is also fine. So remember, whenever it is a PRP, PDT, okay, remember it is your freedom. You have the complete freedom. You can write PRP, PD. Okay, so how will you write? You can write and is ready for transfer is fine, or and is being discharged today is also fine. So understand that. I think that was something. Alvin, was that informative?
Yes.
Yes, that's it. Okay, thank you. So we have to now decide PRPPD or PRPPT. I'm going to take it like he's being, discharged today. It's my freedom. You also have freedom. But since it is a letter to a GP, did you forget this? UPRPPD? Yeah, I think some of you forgot that. We have to select this one. UPRPPD will be the one. You can write UPRPPD or PRPPT, fine, but why are we writing this one? Because we are writing to the GP, patients on GP. So please write the U also here. How? Yeah, update. This is to update the health status of uh, yeah, Mr. Tompa. Now there is a problem for UPRPPD letters. You need to write who that is important, who requires further evaluation and management. He has a possible medicine overdose on Mylanta and is ready for transfer. You may have noticed I used M capital for Mylanta. It's again your freedom. If you are cap starting, there is no such a word in dictionary, so I made a new word. Okay, cap starting. Okay, if you're cap starting any medicine, all the medicine should be cap started. Remember that. Okay, all right. Medicine overdose on Mylanta and is ready for transfer and is being discharged today. But the other one is more convenient and is ready for transfer. Suppose you are contacting this hospital today itself over the phone, and then Dr. Cheshire Steele says, okay, fine, do one thing, you can send the patient right now, I'm free. So this is better and is ready for transfer. So how can you then send the patient to home? So it is always better one, he is ready for transfer is one. Please don't write and is being transferred, because being transferred means you have to get the permission of the recipient. So this is to update the health status of. Why are we writing update here? Because we are writing to the patient's own GP. Okay, so we have completed two parts of this letter. The first part is the launching part. What is that? Launching part is done with DADR. That is here. Launching part is here. Launching of the letter is there. Second part is opening part. We selected UPRPPD for that. Okay, and now we have completed. Now it is time for us to go to the next level, that is narration part. Narration part. For narration part, where we are going to write the whole story, we have to decide if it is V model or W model. Can somebody tell me which model will you select for this one, please? Correct, correct. So happy to hear that you are so prompt in answering this. Good. We don't need to use W here because this one, the past medical history, is not required. That is W. So W has got the second one. That is, this is also past. This is also past. This is also past. That is recent medical history. This is past medical history. Remember, both of them should be medical histories. This is recent one and this is past. Do we have to tell the GP? No way. So that is the reason we have decided to start with the V model, and this is the V model. In the V model, you will be writing this one. As it is already known to you, as it is already known to you. Okay, Mr. Ha was admitted to. So this is Wimbledon Arc Hospital where you are working. Admitted. So we don't have to mention this one. With pain in the abdomen. Okay. Although never write tests were conducted. Okay, although tests revealed no abnormalities, comma. See, remember, after although, just after the word although, please don't put any kind of comma or something here. No commas will come in this area, but the comma will come after a few words. Okay. Okay. Doesn't have the test details. Although test revealed no abnormalities, he doesn't have, okay, fine, that is better one. He doesn't have the, okay, now here, doesn't is used here. We are in the diving area or in the past area. It is, as it is already known to you, Mr. Pa was admitted will be a past part. So this is completely past. Okay, the past part. So this one is known as the past part. As it is already known to you, Okay, or you can simply remove this one. Mr. Pa was admitted with pain in the abdomen. Although tests revealed no abnormalities, he didn't. See, I'm changing things to past tense. He didn't have the test details. Okay, provide the same. Okay. So, this is something known to the patient. Pain continues. Okay. All right. Pain. Now the 6. Discharge the next day. See, remember, this information is known to the doctor here. Okay, so be careful about writing this information. Okay. Once again, now this part you should write this way. Mr. Pa was readmitted to. So again, we don't have to write this one with the previous complaints. If you don't use this D here, you're going to lose a lot of mark here. Readmitted with the previous complaints. Okay, Pa was readmitted on. Let's write the date here. Where is the date? The date is here already. Take this one and write here. So 17. Admitted on, again, the date is to be mentioned here, with the pain in the abdomen, and then you have to mention this date should be coming here. It can be like, don't write the exact date and repeat it after a week or after 2 weeks. Something, this is also completely fine. Okay, after 2 weeks with the same complaints, he wanted to consult on GP. Okay, see, we are writing to Dr. Cheshire Steele, so don't write this way. Consult to you, okay? Consult to you, because we are writing to Dr. Cheshire Steele. You, okay, you don't have to say all these things. Consult you, full stop. On examination, comma. Now, subjective and objective, you know what is the difference between subjective and objective? Subjective is what the patient says, objective is what the test found. Okay, fine. So you have to write all the things here. On examination, he had heartburn, okay, comma, difficulty. Please make it difficulty swallowing, comma, feeling. See, OET will always try to write this cap starting. They will write this way. You should never write that. Okay. Feeling full soon after eating. Okay. Now, along with chest and abdominal pain, and shortness of breath. Okay, vomiting of blood. Okay. He reported vomiting blood and passing black stools, in addition to regurgitation of food or liquids into the mouth. Okay. It was diagnosed that he had. Are you following me? Like you can see here, everywhere only past tense is used. He had a backflow of stomach acid. You can write if you want acids into the esophagus. Spelling wrong. Okay. See, esophagus is completely okay with the OE is also okay. Simply OE is also fine. Okay, esophagus. It was diagnosed that he had backflow of stomach acids into the esophagus, and an X-ray and an X-ray and an X-ray. Please notice this one, and an X-ray. Never write X-ray was performed. Okay, because if there is a diagnosis based on X-ray, so we know that it was performed. Without performing, you cannot have a result. Without writing OET examination, you can never pass OET examination. So never write it was performed. Okay, X-ray, simply write revealed. fatal hernia. We don't have to write this H and okay, this capital hernia. Fine. This is what I wanted to show you. A bit of help from my side. I cannot help you all the while. What we are just discussing is V. We first decided to start with the V method, and this is this one. And here, this V is continuing up to here. V is, I mean, the past area is too much. Okay. Now, here, right? He can. He was discharged. He was discharged with advice. Remember, some people ask me when to write advice and advice. See, this is the answer for that. Here there is one is advice, one is advice. Advice is a noun form. So whenever you write SC, remember SC, SC is basically verb form. And verb form is used for ED forms or ING form, advising or advices. In these situations, only we write S forms. Here we need normal advice, noun form. Okay, he was discharged with advice on lifestyle changes. That changes. Okay, changes and okay, and he was discharged with advice on lifestyle changes and Mylanta once a day and clementine. Okay, cimetidine. Okay, sorry. Okay, sorry. Good. Okay, this is it. Then the next will be a continuation. Patient visited with the diarrhea, cramping pain. All these things are there, and even this also will be past tense. Shocking? Yeah, because today is 29. Today is 29th, and we are writing this letter also on 29. But we have to use past tense also. Again here. So here in this letter, you can notice one thing very simply. This letter, although it is a V type of a letter, there's a problem with this letter. This is having too little of, yes, this is too less. Yeah, these kinds of letters also exist in the OITs. So this is having too much of, sometimes what happens, this can be too little and this can be too much. So you have to always find out what kind of V you are following. Okay. Okay, right. So you can write the remaining part of this letter. All the best. I have not completed this letter. There are, incomplete parts here, but you can write. Please write this letter following the same method. So launching, DADR, opening, UPRPPD, and then the narration part, V model. That's all about this. All the best. You can write this letter now. This class is being over. Meet you again later with a reading. One more class will be there for reading. Please wait for that.
Thank you, sir.
All right.